Imagine suddenly feeling intense fear for no clear reason. Your heart starts racing, your chest feels tight, you struggle to breathe, and it feels like something is seriously wrong. For many people, this experience can feel like a heart attack or a life-threatening emergency. This is known as a panic attack, and it can happen even when there is no real danger. So what exactly is a panic attack? A panic attack is a sudden and intense surge of fear or discomfort that reaches its peak within minutes. It is a result of the body's fight or flight response being activated without a real threat. This response is designed to protect you in dangerous situations, but during a panic attack, it is triggered unnecessarily. When a panic attack begins, the brain, especially a region called the amygdala, signals that there is danger. This causes the release of stress hormones like adrenaline, which prepares the body to react. Your heart rate increases, breathing becomes faster, and muscles tighten. These changes are meant to help you escape danger, but during a panic attack, they create overwhelming physical sensations. Common symptoms of a panic attack include a rapid heartbeat, chest pain, shortness of breath, dizziness, sweating, trembling, and a feeling of losing control. Some people may also feel detached from reality or fear that they are dying. Although these symptoms are intense, panic attacks are not life-threatening. Panic attacks can occur on their own or as part of a condition known as panic disorder, where attacks happen repeatedly and are often accompanied by a fear of having another attack. This fear can lead people to avoid certain places or situations, which can affect daily life. The exact cause of panic attacks is not always clear, but they are often linked to a combination of brain chemistry, stress, genetics, and environmental factors. Imbalances in neurotransmitters such as serotonin and norepinephrine may affect how the brain regulates fear and stress. The understanding of panic attacks has improved over time as scientists studied the body's stress response and mental health conditions. Today, panic attacks are recognized as a medical condition rather than a sign of weakness. Treatment is available and effective. Cognitive behavioral therapy, CBT, helps individuals understand and manage their thoughts and reactions. Medications may be used to help regulate brain chemistry. Breathing techniques, relaxation strategies, and lifestyle changes can also help reduce the frequency and intensity of attacks. Modern technology is also helping in this area. Artificial intelligence and machine learning are being used to monitor patterns in behavior and physiological signals, helping detect early signs of panic episodes. These tools can assist in providing timely support and improving treatment outcomes. A panic attack may feel overwhelming, but it is a temporary response of the body's alarm system. Understanding what is happening inside your body is the first step toward managing it and reducing its impact on your life.